First, Nilesh, thank you for hopping on here with me today. I appreciate you doing this. You were named the Chief Pharmacy Officer at Baptist in March of 2020. An incredible timing. Matter of fact, I don't know if it didn't scare you away from taking the job, but obviously, what was that like taking it then? What were some of the lessons you learned and maybe something that you might have done differently, in retrospect, but appreciate you being here.
Well, thank you for having me, Hayes, today. So March 2020, who knew COVID was going to take off on a tangent that, scared a lot of people. When I took the role, obviously no idea that COVID was going to take it off in that position. But, I think I was there my second week and, we things started to shut down. People, it's like, okay, we got to go work from home. So I said, all right. And now I was in Louisville, Kentucky, and my boss Patrick said, "Unless we're shutting down corporate, here's your laptop. Go home and work from there." So this is my seventh day, I think, if I remember it right. And for all these years, I've been on campus, never skipped a beat. Whether it was the Sandy storm or whatever you want to call it, I've been on site. So this was a new experience altogether. And the first thing is like, okay, how do I get this started? Because I didn't have a lot of idea about the organization, at least the people, except for a couple of the folks. Luckily, I had two good partners, Adrian and Thomas. Thomas, who was actually the contract pharmacy manager, and Adrian, who was the system IT liaison from pharmacy perspective. So those two folks really helped me navigate through, and and the first couple months, even getting used to the work from home environment was a big struggle for me because you're never sitting in your office. I mean, you're there, but most of the time you're walking around and talking to people. So that was a big change. And then COVID really, a lot of the COVID management, interacting with directors at each of the sites, the retail pharmacies. So, took me good 6 months to assess everything put together. Not that if I have to look back and say, well, how do you do it differently? I probably wouldn't change anything because, it was totally different experience. Typically you're so used to working with people, meeting with people in the office, talking to them, asking them questions. This was just more of a different experience where, you're more virtual. So I enjoyed it. Only thing it gave, the negative part is not being in person, but we all have now dealt with it the last couple of years and learning that new way of working.
And so obviously you're back in the office now, I would guess, and you've created a lot of relationships now that you didn't have before the first 6 months or so, for sure.
Right. So actually, as a system, we now have decided, and I think 95% of the folks are now working remote. So now my position has completely become remote. Not only mine, but since then I've built a team, and a lot of my team folks are remote. So technically they're from different parts. I have someone from Massachusetts, I have someone from Florida, New Jersey, you name it, I have. And so I'm now attracting or picking, selecting, what do you want to call it, the best of the best talents from all the different states.
That's interesting because obviously you probably couldn't have done that prior to 2020. So, but you are now. So you're actually recruiting, looking at people that you might know in various parts of the country that you otherwise would not.
Right, because and the new strategy now is part of when I created this is, if we can do a job from home or remotely, I'm going to promote that, because I think as pharmacists we were always stuck in that basement or in a pharmacy somewhere performing our functions. That now technology does offer us variations on how we can do things. So if we can do it remotely, I know there are positions have to be on site, but there are things we can do remotely now. So which I definitely like to promote that, because you don't have to be in the office. You don't have to worry. It provides flexibility to people. They can log in, they can do things, get on meetings when they want to. It really is beneficial.
And you can have,
yeah, and you're doing a lot of meetings, so it's not like your meetings are not going away or something. They're just there. you're just handling it differently.
Well, interesting for sure, and how that technology has allowed you to do this moving forward. So
Right.
anyway, thanks for sharing that with us. And I know that they're glad to have you. And particularly, I can't imagine the last couple of years were like. So thank you for doing this.
Thank you.
Okay, how are the shortages and back orders of drugs and products impacting your day to day for for patient care? Have you had any significant changes, and maybe what kind of forecast are you expecting?
So, interestingly, drug shortages have been part of pharmacists' lives. I've been dealing, at least the last 20 years, I know, drug shortages are something, initially you had 30 drugs. I used to have 100 drugs or more drugs. It's, how you develop strategies around it. Obviously, working with the companies, having alternate strategies, working with your clinical pharmacists, working with your staff, trying to create different care areas where we can use alternative agents where possible, working with wholesalers, working with manufacturers to see how we can work out a system. This always is an ongoing challenge, but it's no different than what we faced during COVID or before COVID. I've been through the big IV fluid shortages in 2017, so a lot of times you have to change your practices. You're gonna have to say, what, I was giving through a IV bag, now I'm gonna give it through a sub-Q. Is it possible? So getting your pharmacists involved, creating those protocols, working with your pharmacy and therapeutics committee, working with your CMOs, and getting those, getting through the system, educating nurses, educating our patients, educating our pharmacists and technicians. So it's a constant process that you never change. There are good days and bad days, but you know what? When you think yesterday was a bad day and today is a even worse day, then you come back and say, "Oh, tomorrow could be better." So you take it by the day.
That's an incredible good attitude. But to your point, you've been experiencing for so long. It's just kind of like it's just a daily thing now. So it's not
Right.
like it's a one-off. But anyway, excellent, excellent. Thank you.
Thank you.
Beyond back orders and shortages of products, drugs, we're now seeing inflation and price increases. What impact has that had so far? And where do you see that maybe in the next several months?
Well, I think, again, I'll give you a historical perspective. Drug prices are always been a big challenge. When generics come on board, we all feel that, drug prices are never going to go. Every year when I used to do the budget and when I continue to do the budget, you always have the inflation factors and everything that you try to pull together and say, okay, what's our forecast for the following year? And the inflation, obviously the inflation's prices and everything are very high right now. But I don't think I've ever had one year where I was never over budget. Either new drugs come on board, obviously generics come in, it helps you offset a little bit. But end of the day, the drug budgets continue to evolve. Prices are always an issue. We used to have annual increases in January or February. Now we're twice a year, sometimes more sporadically. This is something we have to deal with. Shipping expenses and all these are a big factor that comes into play. And the better the way in which I look at it is to how do we look to monitor these, track these expenses better. So this way, when we negotiate with the pharma, is to say, okay, what? Here are the things. Here's what the impact is. Here are the products we're looking at, and how do we negotiate better pricing? So working with the GPOs is going to be a very crucial thing in this front. So partnering up with with the GPOs and pharma is going to be very, very crucial. So this is something you can't run away from it. So it's something we'll have to consistently monitor it.
Mhm. All right, we often hear the term supplier provider partnership, strategic partnership, collaboration. What does that mean to you? And like, what advice do you have for any suppliers or manufacturers listening to us right now?
Sure. So when I talk about partnership, and I think this is years ago, I think I must have said this. I never treat any companies that I deal with as a vendor. I call them partners for a reason. Partnership means not only I have a stake, but they also have a stake in this. So a true partnership is where the companies also care for your success, and
Mhm.
simultaneously we care for their success. While there are issues, there are issues beyond some control of whether it's whatever the situation may be. True partnership is where we can understand each other and move business forward. So, companies that are successful, I have to say, their partnership truly matters because they have the conversation, they're honest with you. Uh, that's the key. You have to be honest. If there's a true issue, come and tell us. We'll work with you. But there are companies who will play games with you,
Mhm.
and that's what you lose that trust, and that makes it more difficult to operate. So, again, partnership is something, trusting each other and getting through a difficult situation. That's
And
the message I would tell the surprise.
my guess is you'll also remember those times when those companies are not completely transparent.
Oh, I have a good memory. Yeah, I have a good memory.
I bet you do. So transparency, honesty, just being forthright.
Yes,
If they've got a shortage coming up, make sure they tell that to you in advance or
correct.
whatever it is. Correct.
Simple as that. Simple as that.
Yeah.
Simple as that.
Good deal. Thank you so much for sharing that. Appreciate it.
Thank you.
Okay, as we look at timelines or what's going on in the market, are there any new technologies or enhancements in pharmacy specifically that maybe kind of have you excited that you're of its potential?
Absolutely. So, I'm very, very excited for our project that I've been working on since I joined Baptist, is initiating specialty pharmacy and centralizing our pharmacy services. So more, building a central distribution center. So the plan is to have a specialty pharmacy along with a mail order facility on one end, and the other end is to, we have 9 hospitals, 10 retail pharmacies, and probably in the next couple of years, adding another 3 or 4 more retail pharmacies. And then plus we have 300 plus clinics. So all these areas need a lot of medications, and the goal is to centralize a lot of the inventory management piece of it. And then, we become that hub where we can supply the hospitals, retail pharmacies, and clinics with medications. So I'm actually very, very excited for this because this will be a great initiative, not only helping with inventory management, but also bringing cost savings down, help with purchasing, help with a lot of streamlining, a lot of the cabinet fills, and kit and tray management, repackaging of medications. So this is something hopefully by next year we'll have this building up and ready and moving forward on that both the fronts.
That is exciting. And so you think about 2 years out?
So my goal by first quarter of 2024 will be live.
Well, that's fantastic. Good news. Obviously, you got a lot on your plate there, though, but that's exciting and something to look forward to. So excellent.
Thank you.
Okay, what was your very first job in healthcare?
My very first job in healthcare, I was a pharmacy technician in the pharmacy. I had no clue about what drugs were. And I went up to the pharmacist there, and so I said, how do I remember these medication names? So, and the owner was fantastic. He said, if you want to learn, start cleaning the shelves. So while I was cleaning the shelves, I would read the drug names. And he said this, that while you're cleaning the shelves, read the drug names. This is how you're going to remember the drug names and know where it's kept. And it was a summer that I spent for a couple months, and that really triggered my interest into pharmacy. And
Mhm.
that's how I got into pharmacy school.
And now we're looking for a lot more pharmacy technicians.
Exactly.
How appropriate. That's where you started. Okay. Again, these are always fun for me to kind of get to know you a little bit. So what is your favorite sport?
So I actually have 2 sports. So
Hmm.
my football obviously is number one, and cricket is my second sport. So when I came from India, cricket was my favorite at that time. Never knew football, but then I came to America and I learned a lot about football. So football and Giants is my favorite team. So
Okay. Well, I have to say, I don't know much about cricket, but it's kind of gotten popular on Instagram and whatnot. And I've watched some of it and it's absolutely amazing to me. I don't know how it's really done, but it's fun to watch for me.
yeah.
Um, all right, last question. And I think this says a whole lot about somebody is what movie have you watched the most?
Oh my God. So I've many action. So I'm a big fan of action movies.
Me too.
And I think probably Mission Impossible or Matrix. I have to say, I lost count after how many times I watched them. But every time it's playing on the TV, I'm watching it again. It's a never like you lose interest into it. So I think Matrix and Mission Impossible are probably the two big ones.
Really good choices. Like Ocean's 11 or 12 and all those.
They're good too. Yeah, they're
Yeah,
good.
we seem to get those on repeat a lot. But anyway, those are good choices. And I appreciate you spending some time and kind of sharing this with us. So thank you so much for doing this.
Thank you, Hayes.
Perfect. Thank you.